Runner's knee versus jumper's knee. Which one do you have? I'm going to explain to you in this video the difference and the similarity between runner's knee and jumper's knee. First, let's dig into how they're the same. So runner's knee and jumper's knee are both characterized by pain in the front of the knee, usually somewhere around the kneecap, around the patella. The pain might be right above the kneecap, right behind the kneecap, even right on top of the kneecap, below the kneecap, or on the sides of the kneecap. Sometimes there's swelling, sometimes there isn't. And the pain might come on when you're starting to go do some exercise, when you're starting to warm up. And then once you've warmed up, the pain tends to subside, it tends to get better. And then after you stop exercising, it might come back again. Usually that's when it's most painful. Now, if it gets more severe, if this problem doesn't get better, then what tends to happen is the pain intensifies. There's a higher chance you're going to get swelling. And then also it might be so painful and so irritated that it never improves once you get to moving. Once you get to running or exercising, whatever activity you're doing, it just still hurts. It hurts the whole time, which puts you in the position where you have to stop. The pain might also change locations. It might move from the top of the kneecap to the bottom of the kneecap, or it might be more on the inside of the knee one day. Or sometimes people even have this problem in both knees, and one knee might hurt one day, and then it feels better the next day, but the other knee starts to hurt. This is common with both runner's knee and jumper's knee. How they are different might be kind of shocking for you. The main difference here is that it depends on what your doctor diagnoses you with, and it depends on the doctor's perception of you. So if you come in telling the doctor that you played basketball or volleyball, which are activities that both involve a lot of jumping, then your doctor is more likely to diagnose you with jumper's knee. Versus if you do a sport that involves more running, or if you're a runner, if you're a cross-country runner, track runner, you like to do 5Ks, 10Ks, marathons, those kinds of activities, then your doctor is more likely to tell you that you have runner's knee. It just depends on the diagnosis from the doctor, but when it comes down to the biomechanics of it, the physiology, like what's actually happening inside the joint, there is no clear difference between runner's knee and jumper's knee. And if you look at the medical research, it is all mixed up. Some people say that patellofemoral pain syndrome is the same thing as runner's knee, but jumper's knee is more patellar tendonitis or bursitis. There is no clear explanation for what exactly runner's knee or jumper's knee is, but I'm going to give you a clear explanation. Let's go back to the foundational diagnosis of this, because we have to look at this from a mechanical standpoint, meaning the way that the bones and joints and tendons and muscles all work together. When you have runner's knee or jumper's knee, which is just, we'll call it for now, pain in the front of the knee. In the research, they call it anterior knee pain. The root of the problem is that there is too much force going to the front of the knee, and it's pulling on the tendon right here that attaches to the kneecap, which can cause the cartilage in the back of the kneecap to rub too hard on the end of the thigh bone right here, and that can irritate the cartilage in the back of the kneecap or on the end of the thigh bone. Then there's a continuation of this tendon. It turns into a ligament down here below the kneecap where it attaches to the shin bone. And anywhere along this space, it can also become painful, irritated, and swollen, maybe down here at the attachment or right below the kneecap. And then there's also bursa, which are these special fluid-filled sacs all around. There's one in the front, there's one right behind the kneecap, kind of a pie, one below the kneecap. There's even one down here off to the side, slightly below the kneecap. All of these things can become inflamed, irritated, painful, and swollen. And so if you have any excessive force going through here, then you can set off any part of that. It just depends what the weakest link in the chain of tissues of parts of your knee, it depends on what the weakest link is for you. That's what's going to flare up first. Now, if you're a runner or a jumper and you're getting this problem, then you have a muscle imbalance where your quads, the muscles that are on the front of your thighs that attach to your kneecaps, they are too strong and or they're too dominant. You're using them too much. And it's causing there to be excessive forces going through the front of the knee. That causes something to begin to hurt and become injured and break down. If it happens long enough, you can develop worse problems like cartilage damage or tendonitis, tendinopathy, tendinosis. Those are just different names for tendon problems in the area that they have different lengths of time. But all of it is rooted in that muscle imbalance. You have two strong quad muscles, two dominant quad muscles, and is putting too much forces through here. Now, most doctors don't understand this. Think about this. Most doctors go to medical school where they're studying medicines and how medicines affect different ailments, different illnesses in the body. And when it comes to joints and mechanical stuff like this, they're not the best at it. What do they do when you go get treatment from them? They give you medications. And if that medication didn't work, they try a different medication, or they try an injection. And if that didn't work, then they refer you out to the surgeon or maybe to a physical therapist. And at physical therapy, they tend to specialize in helping people who have just had a surgery. And so if you're coming to them with runner's knee or jumper's knee symptoms, then they're not going to be the best person to handle your case because they're used to seeing people that had a knee replacement or an ACL reconstruction surgery. And they're used to trying to get people to bend their knee and straighten their knee, but you might have full range of motion. It just hurts when you go jump or do higher level activities. And so you need specific training. And then they're not looking at muscle imbalances. That's not even on their radar for the most part. They are trying to figure out how to get you more motion and how to get you back to running and walking by just forcing you through it. So they'll put you on a bicycle, they'll have you do strange exercises where they work on like the VMO muscle, one of the parts of the quads. All of this stuff is stuff that relates to healing from a surgery, not fixing a problem so that you can avoid medications, injections, and avoid having a surgery. And let's say your doctor sends you to the surgeon instead. Maybe physical therapy didn't work, or they just skipped physical therapy and they sent you to the surgeon. A surgeon specializes in cutting you open to surgically operate on things in the hopes that it's going to heal in a way that's beneficial for you in the future. They're essentially giving you a controlled injury. Because surgeons are trained to do this, they're going to be looking for a reason to operate on you. They might try some other medication or some other injection that a previous doctor you saw didn't try to see if that works. They might go to like gel injections to see, they'll go like the regenerative medicine route at times. But if that doesn't work and you continue coming back to them for help, they're going to continue to offer you surgical interventions. They're going to say, we can do a surgery for this. We can do a patellar tracking surgery. We can go in and clean it up, do a debridement surgery. And that does not fix the root problem. So whether you decide to call it runner's knee or jumper's knee, or patellofemoral pain syndrome, or tendonitis or bursitis, or maybe you've been diagnosed with chondromalacia patella, all of these things, in my strong opinion, are that they are the same root problem. It's just manifesting in slightly different ways. There's some doctors like to take x-rays and tell you have chondromalacia patella. And if you don't have chondromalacia patella, they'll tell you have patellofemoral pain syndrome. And if you happen to run more, then they're going to say you have runner's knee. Or if you happen to jump more, then they're going to say you have jumper's knee. But it's all the same root problem, which is that muscle imbalance that needs to be addressed to take the pressures off your kneecap and off your tendons and bursa in the area and allow it to heal. Then you have to learn how to use your muscles properly when running and jumping so that you can go back to those activities full force with confidence that you're not going to irritate your knee again. If you're looking to get the right guidance on how to treat your knee problem, whether you've been told you have runner's knee or jumper's knee, or patellofemoral pain syndrome, or knee tendonitis, knee bursitis, or even chondromalacia patella, where the cartilage in the back of the kneecap is thinning out or shrinking. If you've been told you have any of those conditions, I've got a program called the Patella Pain Recovery Program. It is my treatment approach at fixing the root muscle imbalance so that you can offload all the tissues in the front of the knee, all the body parts in the front of the knee, and allow it to heal and confidently get back to running, jumping, weightlifting, doing every exercise that you love to do with confidence that it's not going to make your knee any worse. You can find a link to this program down in the description below. It is comprehensive. I put my whole treatment approach in there as if you were with me in the treatment room. And you can get this program anywhere you are, anytime, as long as you have an internet connection and a device with a screen to watch the videos. I'll walk you through step by step how to fix this problem. I've also got tons of videos here on YouTube that help with different kinds of problems related to kneecap pain, both chondromalacia patella and patellofemoral pain syndrome, as well as runner's knee, jumper's knee, and other related problems like this. You'll find links to those playlists down in the description below, right next to the Patella Pain Recovery Program. Hey, Hey guys, if you thought this video was helpful for you, please give us a thumbs up. Share this with somebody you think needs to see this. If you're seeing a healthcare professional right now that's diagnosed you with one of these problems, please share this video with them. I want to educate them on this. I can't tell you how many healthcare providers, professionals that I've seen in my clinic as patients, where I've trained myself, and once I make them aware of these concepts, they get surprised at how many times they've been misdiagnosing people and sending them down the wrong treatment pathways, unintentionally, of course, trying to do their best. But once they can see our process, then they begin to realize, okay, we need to work on the root muscle imbalance, not just shove medications, injections, or push somebody to have a surgery for this problem, because this can heal naturally, which makes many of the surgeries for these kinds of problems unnecessary. If you have any questions, please drop a comment below. We love to get back to our comments. Let us know if you have had this problem and how it's worked out for you, or if you've been helped by one of our videos or many of our videos, let us know as well. That always makes our day. And please, if you haven't subscribed yet, please do so and hit that notification bell so that you don't miss out on any of the helpful videos we post each and every week. Thanks for watching, friends. I'll see you in the next video. Bye-bye.